This is Matt Green from Precision Athletica, and I'm here with a short video just to highlight how we can use the Swing Catalyst pressure plate and software, not only to look at full golf swings and how players use the ground and generate force through the ground in their golf swings, but also how we can use it for assessment purposes to help drive our rehab and prehab programs and training programs. And also not just for the lower body but also for the upper body. So what we have here is we have two young female golfers that are part of our squads here, and what we did was we got them to actually do some push-ups on the Swing Catalyst pressure plate. And the reasoning here was that upper body strength, control around the shoulder blades is really important in all golfers, but especially in female golfers, and especially around the left side because of the high incidence of elbow and wrist injuries in young female golfers. So we want to have some way of measuring how stable they are through their left shoulder blade, and that's really difficult to do. And so what we did was we did some push-ups. We got them to do push-ups on the pressure plate, with the idea being of seeing how they load right to left and using that as a guide as to how stable they were through each side and how stable they were around the shoulder blades. So if we just place some of these videos through, we look at the first one on the left here, and you'll notice that as this young girl does her push-ups up and down, if you look down in the bottom left hand side, you can see that she's got about 70%, pretty consistently sort of mid-60s to 70% of the pressure through her right side. Okay, so that's a clear indication to me that she doesn't want to load or doesn't want to load into her left side because of a lack of stability around that left shoulder blade. Now in her golf swing, that may then result in poor connection between the left arm and the body, increase force through the left arm trying to create speed that's lost through that poor connection at the left shoulder blade, and subsequently the risk of left wrist and elbow injuries. And then if we look at the young girl on the right hand side, we're going to see a similar pattern but a little bit more exaggerated. You can see with her is that sometimes it's up around in the 90s, high 80s to 90s if we look at what's happening here with the pressure through her hands. And again, that's just going to increase the risk of her developing some left wrist, possibly elbow or even shoulder problems. But also too, it's a potential power leak. It's going to decrease her ability to generate force and transfer that force from her body to the arms and the golf club. So it's just a really nice example of how we've used the pressure plates to help drive and really make our programs more individualized and more specific to really target what the athlete needs and not just a generic program. Thank you.